Hi, I'm Melissa Boswell, and I'm a PhD candidate at Stanford University. I'm excited to share my work on mindsets about physical activity in individuals with knee osteoarthritis. So, first, an introduction to the importance of physical activity and mindset. Physical activity is effective for reducing OA related symptoms and improving overall health without serious risk of harm and should be a first line treatment for knee OA. Unfortunately, physical activity is underutilized for management, and overall physical activities in this population are low, which may explain why there's actually a reduction in the long term treatment benefits of exercise. There are many factors that influence physical activity levels for people with osteoarthritis, which include but aren't limited to demographics, osteoarthritis symptoms, physical health status, mental health factors, perceptions about pain, and beliefs about physical activity. One psychological construct that may be impacting physical activity levels and perhaps even influencing many of these other determinants is mindset. Mindsets are core assumptions regarding the nature and workings of things within ourselves and in the world that work together with the properties of the body. They orient people to a particular set of attributions, expectations, and goals. Mindsets are so impactful because they influence what we pay attention to, our affect, so our positive or negative emotions, our behavior, and even our physiology. You might be familiar with mindsets about intelligence, well known as fixed or growth mindsets, but more recently, researchers are studying mindsets about health, such as stress, illness, and physical activity. In fact, we have a mindset about the process of exercising. We can actually measure how appealing exercise is to people through the process of exercising mindset, which is what I focus on in this study. In healthy populations, a positive change in this mindset is associated with greater persistence in an exercise class and higher motivation for future exercise. Additionally, this mindset predicts physical activity above other determinants such as perceived importance of health and self-efficacy. The process of exercising mindset is a 7-question measure that asks about one's opinions about exercising, such as whether it is difficult or easy, boring or fun, or lonely or social. It is a 4-point scale scored from a 1 to a 4, where a higher score indicates a more appeal-focused mindset about exercise. I thought this work on mindsets about exercise was really interesting, and as a biomechanist, became curious about how it may be influencing people with conditions that affect their movement, such as osteoarthritis. So in order to better understand the mindsets that people with OA have and their relationship with physical activity, I conducted an online survey of 150 people with and without knee OA. This included the process mindset measure, measures of health and physical activity, and an open-ended question about how they manage or improve OA symptoms. The survey was repeated 3 weeks later. Before I share the main findings, I wanted to mention that in this study, the process mindset inventory demonstrated strong internal consistency with an alpha of 0.92 and test-for-test reliability, so an interclass correlation coefficient of 0.841 within the knee osteoarthritis population. So first, we found that people with osteoarthritis have a lower process mindset, meaning that they view exercise as less appealing or enjoyable. However, when we control for other variables such as gender, age, BMI, health, and physical activity, mindset was only marginally associated with having knee OA. Secondly, we found that the process mindset was correlated with future physical activity, and this was consistent even when controlling for demographics, health, OA symptoms, and baseline physical activity level. And finally, in terms of management, we saw that exercise was only used by a quarter of participants, which was half as much as those who use pain medications or injections. Importantly, mindsets about physical activity were more appeal-focused in individuals who manage their symptoms with exercise, with or without medications, than those who manage their symptoms with medication without exercise. In conclusion, the process mindset inventory is an efficient, reliable, and relevant scale. Mindset interventions are a promising tool for increasing activity participation and improving health outcomes. I'm excited to continue this research by developing an intervention aiming to help people with knee OA cultivate more beneficial mindsets, and testing whether improving these mindsets increases physical activity participation and exercise program adherence. Thank you to the Neuromuscular Biomechanics Lab and the Stanford Mind and Body Lab for supporting this work, and to Orsi for the opportunity to present it. Please feel free to contact me with questions, feedback, and ideas for future work and collaborations. Thank you.